Welcome! Do you know what today is? Do you? It's the first day of medical terminology and the rest of your life. Yay! Whether you are bound for a career in medicine or just looking for something new and interesting to study, you've made a great choice with this specialization. Why, you ask? So inquisitive. I like that in a student. I can give you 3 good reasons for now. 1, everybody has a body, and it will need healthcare at some point. A basic knowledge of medical terminology will help you navigate the healthcare system, from choosing the right specialist to making sure you understand the diagnosis. 2, it can lead to a job. Medical scribes are always in demand, and taking this course is a great way to learn not only terms, but also the skills to build and break down new terms that you may come across in your work. 3, it gives you the ability to advocate for the health of yourself and your loved ones. Being able to read medical records, pathology and imaging reports, and even prescriptions allows you to make informed decisions about what is happening and what needs to happen. For better or worse, you will have the knowledge and the skills to understand what is going on with your own health and the health of those you hold dear. If you're still watching this video, I'm assuming you're sold on the importance of the course. Smart move! So now let's talk some basic logistics and expectations. First, you should complete the modules and courses in order as the material builds on itself. The first module in Course 1 is unique as it includes basic knowledge and skills that you will need to retain for the entire specialization and for the rest of your life. No pressure, so much pressure. After the first module, we will use a fairly standard format covering 1 or more body systems per module. For Course 1, those systems include integumentary, urinary, and musculoskeletal. In general, you should expect to watch several recorded lectures, make flashcards, and take a quiz over basic definitions for each module. Exams will occur 3 times throughout the specialization at the end of each course. While they are not technically cumulative or comprehensive, you are learning a language, so the words and word parts from the course may be seen on future exams. Don't worry, they're fun, really. Finally, please know a couple of things about me. I have a quirky sense of humor and I try to keep class anything but dull. However, if I ever say anything that you find offensive, please know that it was completely unintentional. I really do love people and my job. Also, I'm going to use the pronunciation for medical terms with which I am familiar. As with any language, there are regional variations and different preferred pronunciations. Potato, potato. Please know that while I will give you my best effort, you should adapt to any alternate pronunciations used by your supervisor or colleagues and embrace the change. Whew, I think that's it. Most students tell me this was one of the simplest but most useful courses they take. I hope you'll find it likewise. Yay for learning! Hi, my name is Laura Kabiri, and I'm a professor here at the beautiful Rice University overlooking the world-renowned Texas Medical Center. Small town Texas born and bred, you'll often find me walking across campus in my dress and Western boots. I attended the University of Houston for my undergraduate education with a Bachelor of Arts in Music and a minor in biology. After graduation from U of H, I attended physical therapy school at Texas Woman's University, which provided my introduction to human anatomy with a full human cadaver lab experience. Dissecting every part of the human body was an invaluable learning opportunity, and I will be forever grateful to the people who donated their bodies for our benefit. What an amazing gift. As a licensed physical therapist, I worked for the Methodist hospital system in the acute care or hospital setting. I worked with everything from post-op joint replacements to strokes to flesh-eating bacteria-infected wounds. I loved working with the medically fragile and complex. During this time, I was blessed with twin sons, and I took a detour into academics as adjunct faculty. I quickly became addicted to teaching and went back to school to pursue a concurrent DPT PhD when the twins started kindergarten. They colored, I dissertated. It worked. In 2018, I was hired for my dream job at Rice University, and I've been here ever since. I teach human anatomy, physiology, and medical terminology, as well as other advanced electives. In my spare time, I like to build furniture in my woodworking shed, read inspirational historical fiction, volunteer in the community, and explore new cultures through travel, food, and music. It's taken divine intervention and a village to get me where I stand today. I'm so grateful for all of the help along the way and strive to pay it forward to others. In short, if you remember nothing else from this video, remember to embrace the journey of life and the people along the way. It may not go as planned, but I'm living proof it could turn out better than your wildest dreams. Welcome! I'm so glad you have decided to explore learning the language of medical terminology with me. Whether you are bound for a career in medicine or just looking for something new and interesting to study, you've made a great choice. Why, you ask? Let me count the ways. 1. Studying medical terminology can promote good health. Everybody has a body, and it will need health care at some point. Perhaps you will need advice on preventative care to remain healthy, medical care to address a disease or disorder, or rehabilitative care to recover from an injury. Regardless of the reason, we all encounter healthcare needs at some point. A basic knowledge of medical terminology can help you navigate the healthcare system. From choosing the right specialist to making sure you understand the diagnosis, speaking the language helps. Knowing which doctor specializes in treating which part of the body may prevent wasted time and money seeking a referral to a specialist through a general practitioner. Medical terminology can also help make a confusing diagnosis clear and even help you understand what kinds of tests, images, and referrals a healthcare practitioner might order. Empowering yourself with a basic understanding of medical terminology may also decrease some of the fear and uncertainty that can accompany interactions with the healthcare system. This decreased fear can in turn lead to increased confidence in your ability to obtain the proper medical attention, which may also increase the likelihood of seeking out healthcare and promoting good health. Ta-da! Studying medical terminology can promote good health. Studying medical terminology also promotes effective communication between a healthcare provider and the patient. Have you ever been surrounded by people who were all speaking a language that you did not understand? I have. It can be very confusing. What might be a kind word can sound like an insult. The inability to understand what people around you are saying can create a sense of paranoia. Wait, what did you just say about me? Not speaking the language can also make it more difficult, if not impossible, to tell people what you need. If you have ever seen a toddler having a tantrum or been the recipient of their wrath, you know the importance of being able to communicate your needs and the frustration of not being able to do so. The same holds true with the language of medical terminology. Perhaps you need to be able to clearly express your symptoms to your healthcare provider who just isn't understanding what you're trying to describe. This course can help. Perhaps you already speak medical terminology in your native language but are seeking to provide healthcare to the English-speaking population. This course can help. Whether you are the future healthcare provider or the current patient, studying medical terminology promotes effective communication. And now for a 10-second brain break. Are you still counting? So far, I have given you 2 reasons why you should study medical terminology: health and communication. But wait, there's more. Reason number 3, using medical terminology properly earns respect. Have you ever had a friend, colleague, or love interest who spoke a different language? I have. Learning the basic greetings and phrases like hello, please, thank you, yes, and no in their native language was one of the first things I did to show respect for them and their culture. Even if I did it with a thick Texas accent, they knew I was trying, and I got better with practice. Or maybe you were the one who spoke a different language. How did it feel when someone expressed interest in learning to communicate with you in your native language? Even if they didn't do it perfectly, the sincere and honest effort mattered, right? Just like communicating with someone in their native language, using medical terminology with a medical professional tells them that you understand their background and are attempting to relate to them on a deeper level. This can allow for more open, meaningful conversation. Even if you can't speak medical terminology fluently, being able to understand and repeat the medical terms correctly in layman's terms shows respect for the language. It can also build the healthcare professional's respect for you and your ability to understand the situation. Using medical terminology properly earns respect. Number 4, studying medical terminology may lead to a job. Whoop, whoop. Have you heard of medical scribing? A medical scribe is someone who assists a medical professional, usually a physician, by gathering and documenting information from the patient's visit in an electronic healthcare record. A solid foundation in medical terminology can be an asset on your medical scribe resume. Beyond medical scribing, perhaps you want to work in a healthcare office or volunteer with a healthcare organization. Studying medical terminology may help you during interviews and make you feel more comfortable and confident in your work environment. Taking this course is a great way to learn not only the medical terms themselves, but also the skills to build and break down new terms that you may come across in your work. Nifty. Official disclaimer, please note that this course does not in any way guarantee employment, but building medical terminology skills may help you feel more confident in applying for healthcare positions and could be an attractive addition to your resume. So cultivate those skills and watch them grow. Finally, the fifth reason to study medical terminology is to facilitate the ability to advocate for the health of yourself and your loved ones. Being able to read medical records, pathology and imaging reports, and even prescriptions may help you make better informed decisions about what is happening and what needs to happen. For better or worse, you can have the knowledge and skills to understand what is going on with your own health and the health of those you hold dear. As with all good things, this lecture too must come to an end. Thanks for exploring why you should study medical terminology with me. See you next time. Welcome! I'm so glad you're joining me today. In this lecture, we will continue our exploration of medical terminology by looking at common word parts found in medical terms. Specifically, the language of medicine is made up of three main building blocks: root, suffixes, and prefixes. Let's start by taking a closer look at the roots in medical terminology. Just like roots are the foundation of a plant, a root in medical terminology is the foundation or subject of the medical term. It also rhymes with boots and hoots. Get it? Hoots, like an owl? Go Rice! Roots tend to function like nouns in the language of medicine. They are often followed by a combining vowel signified by a slash and the letter O. We will talk more about combining vowels later. Get excited, people! I know. You can't wait? Me either. For now, just know that the presence of a combining vowel tells us that the word part is a root. Some meanings may have more than one root. For example, hemo and hemato both mean blood. Also, root words with the same meaning can be spelled quite differently. Consider angio and vaso and vasculo, which all mean vessel. There are many common roots for which you will be responsible in this course. They should be committed to memory as soon as possible. Before continuing with this lecture, please click on the link to access a list of roots that should be included in your flashcard deck for this module. Did you really click on the link? Really? Or did you squirrel? Squirrel! Where? Oh, just a picture. Back to suffixes. While a root is the foundation or subject, a suffix is added to the end of a word in medical terminology to provide meaning. Like a caboose on a train, suffixes are found at the end of a medical term. They give essential meaning to the term itself. Simple suffixes are basic and are used to turn a root into a complete word. They might make the root an adjective, a noun, or a diminutive version. Diminutive versions are smaller versions of the term itself. They function similar to cute versus cutie in the English language or hijo versus hijito in Spanish. They change the root to mean something small. Aren't you just the cutest little root that ever lived? Yes, you are. Yes, you are. As with roots, there are many suffixes for which you will be responsible in this course. They also should be committed to memory as soon as possible. Before continuing with this lecture, please click on the link to access a list of suffixes that should be included in your flashcard deck for this module. For real, do it now. Opposite of a suffix, a prefix comes at the beginning of the word like the engine of a train. Toot, toot! Prefixes are not always necessary in medical terminology. When needed, they are added to the beginning of a term to further modify the root. There are also many prefixes for which you will be responsible in this course. So many responsibilities. Can you do it? Of course you can. To conclude this lecture, please click on the link to access a list of prefixes that should be included in your flashcard deck for this module. Thanks for exploring common word parts of medical terminology with me. This train is leaving the station. Bye. Bye-bye. Bye-bye. Bye. Welcome. In this lecture, we will continue our exploration of medical terminology by looking at how we can take parts of medical terms and use them to translate and build entire words. The best part is you don't even have to know the word to translate or build it. Medical terminology is all about being able to put the parts together. So far, we know that medical terms are made up of parts called roots, suffixes, and prefixes. But you might have noticed that roots in medical terminology often have a /o at the end, whereas suffixes and prefixes do not. Let's start with a look at roots and why they're different from other word parts. Roots in medical terminology contain a /o, known as a combining vowel. The combining vowel is added to more easily combine the root with other word parts. The O can be thought of like the little bumps on the building blocks shown here. They help link one part to another. A combining form is what we call the root plus the combining vowel. The example combining form of a root shown here is cranio. Sometimes we want to include the combining vowel in the new medical term. Here we provide the first of two main rules for building terms that keep the letter O. Keep the combining vowel if you are joining a root to a suffix that begins with a consonant. For example, the combining vowel remains when joining entero to logy to form enterology, or the study of the intestines. Yum! You also keep the combining vowel if you are joining any two roots together, even if the second root begins with a vowel. For example, the combining vowel remains between the roots gastro and entero in the word gastroenterology, literally translated as the study of the stomach intestines. Do you see all of the O's? Even though entero begins with a vowel, we keep the O in gastro because we are combining two roots. However, we don't always want to keep that combining vowel. Sometimes we want to drop it. Drop it! Good doggy. Good job. Here we provide the rule for building terms that drop the letter O. Drop the combining vowel if the suffix begins with a vowel. In these cases, keeping the vowel would make the word more awkward to pronounce. For example, the surgical removal of the stomach is called a gastrectomy. The root is gastro and the suffix is ectomy. Because the suffix begins with a vowel or the letter E, we drop the combining vowel O to make gastrectomy. Otherwise, the word would be gastroectomy, which just doesn't work as well. And now for a 10-second brain break. Now that we know that roots have combining vowels, we will look at how we can use parts of medical terms to help translate entire words. In order to be able to understand the meaning of a medical term, it is important to be able to break it down into its parts and then translate them methodically. Easy peasy. The first step in translating a medical term is to break down the word into smaller parts. It makes it less intimidating and more manageable to consume, just like eating a watermelon. How do you end up eating the whole thing? One slice at a time. Delicious. Most medical terms have at least a root and a suffix. Many will also have a prefix, and some will even have multiple roots. But don't worry, the rules are the same no matter how many parts a term has. Step 1. Break down the big word into smaller parts: suffix, root or roots, and prefix, if there is one. The second step in breaking down a medical term is to translate the suffix. That's right. Translating a medical term is just like reading a good book. Start at the end. Wait, you don't read your books that way? How do you know what's going to happen? When translating a medical term, it is customary to say the meaning of the suffix first. Don't believe me? Consider the word psychology. Logy is the suffix and means the study of. Psychology is translated the study of the mind. See? Suffix first. Otherwise, it would be translated the mind the study of. Step 2, translate the suffix. The third step in breaking down a medical term is to translate the prefix. Yep, we start at the end and then go back to the beginning. After translating the suffix, return to the starting line and translate the prefix. But what if the word doesn't have a prefix? No problem. Skip right through this step and move on to step 4. The fourth step in breaking down a medical term is to translate the root or roots. Just like roots anchor a tree, roots in medical terms anchor the meaning. They come last in translation and hold that term down. If a term has more than one root, you translate the roots in order of appearance, left to right. Step 4, translate the root or roots. The last step in translating a medical term is to put the parts together. Don't forget to put them together in order: suffix, prefix, if there is one, root or roots. Step 5, put the parts together. Let's try it. This medical term contains a prefix, root, and suffix with which you should already be familiar. How did you do? Let's find out. When we break down the word, we get the prefix tachy, the root cardi, and the suffix ia. Next, we translate the suffix. Ia means condition. Then we translate the prefix tachy, which means fast. Finally, we translate the root cardi, meaning heart, and put them all together in order. Condition of a fast heart. Yay-yo! Tachycardia means an abnormally fast heart rate. Condition of a fast heart. Well done! Want to try another one? Sure you do. This next medical term also contains a prefix, root, and suffix with which you should already be familiar. How did you do? Let's find out. When we break down the word, we get the prefix sub, the root cutane, and the suffix us. Next, we translate the suffix. Us means pertaining to. Then we translate the prefix sub, which means beneath. Finally, we translate the root cutaneo, meaning skin, and put them all together in order. Pertaining to, beneath the skin. You did it again! Subcutaneous means pertaining to, beneath the skin. If you get a subcutaneous injection, they are injecting something beneath your skin, like some injected medications. Well, I think you've got it, but keep practicing. Just wait and see how many times you get to use this skill in the course and the rest of your life. Go forth and translate terms, people. As with all good things, this lecture too must come to an end. Thanks for exploring how to translate medical terms with me. See you next time. Welcome. In this lecture, we will look at how information is organized in medical records, learn common terminology for body orientation, and finish up by looking at a few abbreviations. Ready, set, go. Health records come in different lengths and formats. You may hear them referred to as an EHR, or electronic health record, or an EMR, or electronic medical record. The EMR is like the patient's chart from a single clinic or practice visit, while the EHR is more global and holistic, with information from multiple doctors over multiple visits. In this video, we will focus on the medical records that you might see as part of the larger health record. While the detail and content of a medical record may vary based upon the type of healthcare practitioner and setting, there are some common elements. The first common element in medical records is the chief complaint. It is the main reason for the patient's visit. It might include things like sore throat, pain in a joint, or a rash. The second common element in medical records is the history of present illness. It is the story of the patient's problem. It usually includes things like when the symptoms began and if there was a particular event that caused the symptoms, like slamming your fingers in a car door. Been there. Ouch. Review of systems is the next common element in medical records. It includes a description of individual body systems in order to discover any symptoms not directly related to the main problem. It's also just part of good practice. In other words, even if you go to the doctor with an eye complaint, they are also going to check your heart and lungs. Other common elements of medical records include the patient's past medical and surgical histories. You've probably answered questions about these every time you've gone to the doctor. PMH, or past medical history, tells the healthcare provider if you've had any other significant past illnesses like high blood pressure, asthma, or diabetes. Your past surgical history lists any previous surgeries. There are two commonly accepted abbreviations for both past medical and surgical histories, as shown here. The patient's family and social history are also common elements in medical records. The family history checks for significant illnesses that run in the patient's family. The social history includes a record of habits like alcohol, drug, and tobacco use that can impact health. It may also include information on a patient's living situation and support available to them during their illness. As with past medical and surgical histories, family and social histories also have two commonly used abbreviations. If you haven't found the pattern yet, history can be abbreviated as simply a capital letter H or a big H followed by a little x. Potato, potato, they both mean the same thing. As we continue our discussion of medical terminology, it is important to discuss the organization of information within a medical record. One commonly used method of organizing information is the SOAP note. SOAP is an important part of good hygiene. Life tips with Dr. Kabiri. You're welcome. However, SOAP is also an acronym for the 4 different types of information documented by healthcare providers in a medical note. S stands for subjective, O stands for objective, A stands for assessment, and P stands for plan. The S in SOAP note stands for subjective. And medical records, this section includes what the patient says. If something is subjective, that means it is influenced by a person's opinions, feelings, or preferences. Perhaps that can help you remember that the patient's thoughts, opinions, and how they feel belong in this section. That might include things like the chief complaint, symptoms, abbreviated big S, little x, history of present illness, past medical and surgical histories, family history, and social history. Important! This section should record exactly what the patient says, even if it doesn't match what the clinician thinks. That part comes later. S is for subjective. The O in SOAP note stands for objective. And medical records, this section includes what the tests reveal. If something is objective, that means it is not influenced by personal feelings or opinions, but rather represents fact. It is not biased by human emotion or thought. Perhaps that can help you remember that the findings of medical tests and examinations go in this section. Things that should be included in the objective section include findings from the physical exam, abbreviated PE, and review of systems, as well as the results from lab work, tests, and imaging like X-rays, MRIs, or CT scans. O is for objective. The A in SOAP note stands for assessment. This section contains the practitioner's assessment of what is causing the subjective complaints and objective test results. We call this the diagnosis, abbreviated big D, little x. Sometimes a patient might not have a clear diagnosis. In this case, the practitioner may include a differential diagnosis, abbreviated DDX, which is a list of possible conditions that might be causing the problem. I've been a medical mystery several times in my life. I like to do my part to keep healthcare providers thinking. Either way, the diagnosis or differential diagnosis go in the assessment section. A is for assessment. The P in SOAP note stands for plan. This section obviously tells you what the practitioner plans to do about their findings. The plan includes the treatment, abbreviated big T little x, which might be a therapy or prescriptions, abbreviated big R little x, or surgery. Referrals to or consults with a specialist should go in this section, as well as any additional tests that might be needed to help clarify or confirm a diagnosis. P is for plan. And now for a 10-second brain break. We will now move from a general discussion of medical records into a more specific discussion of medical terms. First, it is important to establish a common frame of reference when referring to the body. We also need to explore common medical terms that refer to the body's orientation to itself and space. But first, an IVQ. Good thing you just had that brain break. Anatomical position refers to a person standing face forward, arms at the side, with palms forward. It is important to know what anatomical position looks like because it serves as a standard reference. For example, the head is always superior or above the knees. This would be true even if the person were upside down because we always refer to the relative position of body parts using anatomical position. Proximal or distal refer to the distance from the trunk. It is used only when describing the upper extremities or arms and the lower extremities or legs. Proximal means closer to the trunk and distal means further away. For example, the ankle is distal to the knee. Medial or lateral describe the relationship to the center of the body. Medial means closer to the center of the body and lateral means further away. For example, the thumb is lateral to the other fingers in anatomical position. Ventral and anterior refer to the front of a human. The opposite of ventral and anterior is dorsal or posterior. They both refer to the back of a human. If you're familiar with sharks or dolphins, they both have a dorsal fin on their back. This might help you remember that dorsal means back. Superior or inferior are anatomical antonyms which mean above and below. For example, the head is superior to the trunk, even when posed like this. Wow! I would totally fall into that lake if I tried that. Supine and prone refer to the position in which a person is lying. Supine means lying on the back facing up, while prone means lying on the belly. And this picture, the one puppy is in prone, and the two puppies are in supine. All the puppies are adorable. When referring to sides of the body, ipsilateral means on the same side of the body, while contralateral means on the opposite side. We refer to ipsilateral and contralateral often when talking about the brain's control over the body. Since the left side of the brain controls the right side of the body and vice versa, we say that the brain has contralateral control. Since you've probably picked up on the fact that lateral refers to side, it should make sense that unilateral means on one side, while bilateral means on both sides. As you can see here, this patient has a unilateral leg fracture. If both legs were broken, we would say the patient had bilateral fractures. As a final series of orientation terms, there are special names for the surfaces of the feet and hands. Plantar refers to the bottom or sole of the foot, while palmar refers to the front or palm of the hand. Dorsal refers to both the top of the foot and the back of the hand. In this picture, the palmar surface of the therapist's hands are being used to massage the plantar surface of the patient's feet. The dorsal surface of the therapist's hands are visible, and the dorsal surface of the patient's feet are resting on the table. Got it? Good. To finish our video for today, I have assembled a list of commonly used abbreviations with which you should be familiar. Some of these you may have seen in the video today, and some will be new. Please note that this is not an exhaustive list, but it should provide you with some abbreviations you may see more frequently. As with all good things, this lecture too must come to an end. Thanks for exploring parts of a medical record, common orientation terms, and abbreviations with me. See you next time. Welcome! Thanks for joining me today. In this lecture, we will begin our exploration of medical terminology as it relates to the integumentary system. Let's get started. The integumentary system is a medical term for your skin. The largest organ of the body, your skin serves as your outer covering. The branch of medicine that specializes in the integumentary system is called dermatology. Let's begin by looking at the basic purposes of skin. But first, let's look at this adorable baby camel. Be careful, they spit. The skin plays a primary role in protecting the body from the outside environment. This may include things like forming the first line of defense against germs and pathogens, or preventing irritants from entering the body. As the first point of contact with your outside surroundings, the skin must be tough enough to handle regular bumps and scratches, but gentle enough to sense changes in the environment. A second purpose of the skin involves maintaining homeostasis, or a relatively stable internal environment. In particular, skin helps regulate body temperature as insulation. It can both warm the body by keeping heat trapped inside, as well as allow for cooling through mechanisms like sweating. I suppose you could say that your skin is like the OG cooler, and they thought they were innovative. Before we get much further in the discussion, let's go over some basic anatomy of the integumentary system. The epidermis is the outermost visible layer of the skin. It is made up of very thin layers of squamous cells. Squamous cells are thin and flat and overlap slightly like fish scales. Most interesting, there are minimal blood vessels in the epidermis, which is why superficial minor abrasions or scrapes do not always bleed.
Ew, gross!
It's also why you can do this cool party trick. Not that I'm recommending it, but as long as you stick to the superficial epidermis, no blood, no pain. Back to the lecture at hand. Get it? At hand.
Oh.
The dermis is the middle layer of the skin. It is much thicker than the epidermis and mostly made up of thick, strong fibers. This allows the skin to be pinched and resistant to tearing. It's a good thing if you have siblings. The dermis also contains hair follicles, nerves, and glands. As mammals, human bodies are covered with visible hair. A hair follicle holds the hair. Fun fact! All of the hair follicles in the human body are formed by the time we are just 5 months old in the womb. You will also find nerves within the dermis, or the middle layer of the skin. They are responsible for things like detecting pressure, temperature, and pain. Glands, or groups of cells that release fluid, are also found in the dermis. There are 2 main types of glands in the skin: sweat glands, which release sweat, and sebaceous glands that secrete oil. Sweat cools the body and gets rid of waste. Sebum, or oil, lubricates the skin. Sebum also waterproofs the skin. Don't believe me? Watch the water beat up on your skin while dancing with abandon in the rain. Odds are, other people will watch you too, but who cares? Life is made to live, people. A final accessory structure of the skin, nails are found at the ends of fingers and toes. They are made of a hard substance known as keratin and serve to protect the ends of our digits, which are most susceptible to damage as we interact with our environment. Nails can also serve as a good base for movement and a great way for self-expression. And now for a brain break. Back to the topic at hand, skin. We will continue our exploration by learning some new word roots related to the integumentary system. Fun fact, your skin constantly sheds dead cells, about 30 to 40,000 cells every minute. That's nearly 9 pounds per year.
Ew.
I think most of that goes into our mattresses. Mattress protector? Yes, please. There are multiple word roots that all mean skin. They include cutaneo, dermo, and dermato. You can find them in words like cutaneous, epidermis, and dermatology. As with skin, there are 3 new word roots that mean fat. They include adipo, lipo, and steato. They can be found in words like adipose tissue, liposuction, and steatosis. Fat gets a bad rap. While we definitely don't want an overabundance, an inadequate amount of fat can be just as unhealthy. Fat is a necessary component of skin and serves as insulation to help maintain body temperature. It also plays a role in hormone function. So go ahead, indulge every once in a while, all things in moderation. For the word hair, you should know both pylo and tricho. They can be seen in the words pyloid and hypertrichosis. Hydro is a word root that means sweat. It can be seen in the term hyperhidrosis. Hydration makes me think of fluid intake, which makes me think of fluid loss, which makes me think of sweating. Weird and wonderful in this brain of mine. Whatever works for you, don't forget to hydrate. And that hydro means sweat. Meaning scale, squamo can be found in the word squamous. Squamous describes the skin cells of the epidermis which overlap like fish scales. So, under a microscope, we all look like beautiful merpeople. Nail, as in fingernail or toenail, has 2 common word roots, onycho and unguo. Words like onychectomy and subungual demonstrate their use. Recall that oil is responsible for moisturizing and waterproofing the skin. The roots sebo and sebaceous both mean oil, as in sebum and sebaceous gland. Did you know that we all have relatively the same number of melanin-producing cells, or melanocytes? The melanin production itself changes. The next roots pertain to abnormal skin texture and color. Skin will tan with UV radiation exposure, like sun or tanning beds, because the melanocytes produce more melanin. They darken to protect the cell nucleus, which they cover from harmful UV rays and thus prevent damage to the cellular DNA. Melanocytes are like your own nuclear umbrella attempting to shield your DNA from the sun. How cool! These roots pertain to skin texture. Kerato means hardness, as in keratin found in your nails. Xero means dryness, as in xeroderma, or dry skin. Crypto means hidden, as in onychocryptosis, or an ingrown or hidden toenail. Finally, these word roots pertain to skin color or appearance. Leuco means white, as in leukocytes, which are white blood cells. Erythro means red, as in erythroderma, which you might see with a rash or allergic reaction. Xantho means yellow, as in xanthoderma, seen in jaundice, and melano means black, as in melanoma, which is a dark-colored skin cancer. As with all good things, this lecture too must come to an end. I know you're sad. Thanks for exploring introductory terms and roots related to the integumentary system with me. See you next time. Welcome! I'm so glad you're here, because in this lecture we will discuss some common medical terms related to the integumentary system that you might find in the subjective portion of a dermatology note. Recall that subjective terms are those that the patient reports to the healthcare provider. They are the reason why the patient wants to see the dermatologist. Most often, patients will come in complaining of a new rash. Here are some other common skin complaints that might also bring someone to the dermatology clinic. Remember that these terms are not a particular diagnosis in themselves, but rather symptoms used to generate a forthcoming diagnosis. The first common complaints include dermatalgia or dermatodynia. Both terms simply mean painful skin. And now for story time with Kabiri. Once upon a time, my son complained of dermatodynia. Nothing else, just that his skin hurt and wearing clothes hurt. Being the good mother that I am, I told him to go to bed. It'd be better in the morning. The next day, he had a small blister on his chest. I attributed it to him getting hit in the chest during dodgeball at school. The next morning, he had a blister behind his ear. I gave in and took him to the local emergency room. They told him they didn't do pediatrics and had no idea what it was, but that he might die. Seriously! Terrible bedside demeanor. So I drove all the way to Texas Children's Hospital in the medical center. Their urgent care was closed, though, for a staff meeting, but they said I could go to the ER. Grumbling about the copay for an ER over a few skin blisters, I went anyway. I was there, right? Turns out, the doctor came in and immediately admitted him for Staphylococcus scalded skin syndrome. His skin was literally burning itself from the inside out. After IV antibiotics and ice packs all over his body, we were sent home where his skin continued to blister and peel over his entire body for 2 weeks. Needless to say, I felt horrible. Mommy guilt is a real thing, y'all, and he got everything he wanted for the rest of his life. Don't ignore dermatalgia. The end. Another common complaint includes pruritus, or an itch. This complaint is common in several diagnoses, including xeroderma, or dry skin. Urticaria, or hives, is another common dermatological complaint. Hives are usually associated with allergic reactions and can even be triggered by emotional distress. In addition to general complaints, some patients may complain about conditions related to how dry or oily their skin is, like seborrhea. Wait, what? What? Don't worry, seborrhea. It just means a discharge of oil. While some oil is necessary to moisturize and protect the skin, an overabundance of oil can lead to conditions known as cradle cap in infants or dandruff in adults. Head and shoulders, anyone? The opposite of skin with too much oil would be skin that is too dry. Xerosis means a condition of dryness. As you can see here, xerosis can lead to visible cracks in the epidermis. Finally, skin moisture can also come from prolonged exposure to water. Have you ever been in the pool or hot tub so long that you come out with the pads of your fingers all wrinkled like pale little prunes? Or maybe you've worn a bandage around a cut and when you remove it, the skin beneath is also pale and clammy. In both conditions, we would describe your skin as macerated. Macerate means to soften the skin. This can actually serve a medical purpose to remove skin that is diseased or dead. If you've ever noticed, macerated skin is much easier to scrape off or remove, which may or may not be the desired effect. Sweating. No, I'm not describing my current status or making a plug for deodorant. I'm just leading us into the next category of common complaints that might lead someone to seek out a dermatology consult. Sweating. Hyperhidrosis, or excessive sweating, is a common phenomenon among humans, especially in Houston. However, sometimes sweating occurs at inappropriate times, like when the body does not need to cool down or in excessive amounts. The most common sites that people complain of hyperhidrosis include the palms of the hands, the axilla, that's the medical term for armpit, and the soles of the feet. Hyperhidrosis can be treated with several different techniques, including iontophoresis, or the delivery of electrical current while the body part is submerged in water. Warning! I did not just say mix water and electricity to keep from pitting out. Iontophoresis should only be done under the supervision of a licensed professional. Otherwise, you might have more than just sweating to worry about. Hyperhidrosis can even be treated with Botox injections to temporarily paralyze your overactive sweat glands. While most of us sweat more than we might like, true hyperhidrosis is clinically different. The opposite of hyperhidrosis is anhidrosis. Anhidrosis means lack of sweating, and while it may not be something of which a patient complains, it is definitely noteworthy, particularly as a classic sign of heat stroke. When a person is exercising outside in hot, humid environments, like Houston, for too long, their body temperature can become dangerously high. This usually leads to profuse sweating or hyperhidrosis, initially in an attempt to cool the body down. However, eventually the hyperhidrosis can lead to dehydration and anhidrosis as the body simply has no more water to lose the sweat. Heat stroke is a life-threatening condition and requires immediate emergency medical attention and cooling to prevent permanent damage and even death. Call 911. The next category of common integumentary complaints include discolorations of the skin and abnormal hair loss or growth. But first, fun fact. Did you know that 50% of your hair may be lost before it's even noticeable?
Wow.
Think about that for a bit. Changes in skin color can occur as a result of depigmentation or loss of skin pigmentation. This picture shows depigmentation in the lighter pink areas of the neck with normal pigmentation in the darker tan areas. While depigmentation is a loss of skin pigment leading to a lighter skin appearance, hypermelanosis creates a darkening of the skin's natural pigmentation. This can be seen in the darker maroon or brown areas of the photo as opposed to the normally pigmented skin of a lighter tone. Sometimes patients will seek out dermatology services related to abnormal hair conditions. These can include alopecia or hair loss. Alopecia is a general term for hair loss and can be caused by a variety of things, including hereditary or hormonal issues or even the normal aging process. Personally, I think bald is beautiful. The opposite of alopecia is hypertrichosis, or too much hair. This excessive growth of hair can occur on different areas of the body and to different extents in different individuals. It is shown here on the back of a young child. Most cases of hypertrichosis are of unknown cause. Finally, I would like to conclude this lecture with a few subjective integumentary terms that just might come in handy should you find yourself trying to avoid a particularly sticky situation. These terms are being provided for educational purposes only. Any use for personal gain, either real or imagined, is not being endorsed by this professor, this department, this university, or any of their affiliates. Use at your own risk. Our first ominous integumentary term is rhytodermia, as in, sorry, Mom, turns out I can't come home to help clean out the attic this weekend. I think I'm developing rhytodermia. Sounds like a serious disease, but it really just means wrinkled skin. If that doesn't work, you might try onychophagia. Yes, Mom, I know that wrinkles are a normal part of the aging process, so I could still come, but the smell of mothballs triggers my onychophagia. Yep, the good old medical term for nail biting should ensure that your weekend is attic-free.
Yes!
As with all good things, this lecture too must come to an end. Thanks for exploring subjective terms related to the integumentary system with me. See you next time. In this lecture, we will continue to discuss some common medical terms related to the integumentary system that you might find in the objective portion of a dermatology note. Recall that objective terms are those that the practitioner will observe or discover through labs and tests. They are used to describe what the dermatologist finds in their examination. Patients will often come in complaining of a rash. The appearance of the rash will help the practitioner diagnose the cause. The description commonly includes things like the rash's location, size, color, and texture. My friend is a dermatologist, and she says she gets a lot of interesting pictures from friends and family through text. Is my arm supposed to look like this? I guess every job has its hazards. Practitioners often start by describing a rash as localized or generalized. In other words, is it confined to one area or has it spread to others? Sometimes bumps in the rash will have fluid inside. One type of fluid-filled bump is a pustule. Pustules are pus-filled blisters, as seen here. Other common injuries to the integumentary system that might require a dermatology consult include burns. Burns can result from exposure to harmful agents, including heat, radiation, chemicals, electricity, or friction. A first-degree burn is the least damaging type of burn. It involves only the superficial layer of the skin or epidermis, which often peels off and is replaced with a new epidermal layer as it heals. A sunburn is a common type of first-degree burn. A second-degree burn is a more severe burn than a first-degree burn. It involves the epidermis as well as the underlying dermis. A common characteristic to distinguish a first versus a second-degree burn is the presence of blistering. Severe sunburns as well as thermal burns from touching boiling water or an extremely hot object can cause second-degree burns. And now for a public service announcement. Did you know the most common reason for burns in infants is bath water that is too hot for their sensitive skin? The most common burn locations are the buttocks and feet as the baby is lowered into the water. Please, please, please use a thermometer to check the water temperature before bathing an infant. They are inexpensive and they even make them in cutesy little shapes. We will now return to our regularly scheduled programming. A third-degree burn involves the epidermis, dermis, and the subcutaneous tissue. Prolonged exposure to boiling liquids, especially sticky or viscous liquids which make them difficult to remove, or exposure to direct flames are common causes of third-degree burns. A fourth-degree burn is the most severe burn classification. It involves damage beyond the skin to deeper tissues like bone and muscle. Prolonged exposure to direct flames, chemicals, and high-voltage electricity are common causes of fourth-degree burns. They are often black or waxy in appearance. Interestingly, fourth-degree burns are the most severe but also the least painful. Why? The nerves which transmit pain signals are also destroyed and no longer able to function. Aww. And now for a 10-second brain break. Look at the cute baby koala! Moving on, let's look at some objective terms related to epidermal tumors. The first and perhaps the more common type of epidermal tumor or growth is a nevus. Nevus is Latin for birthmark or mole. If there is hair growing out of the mole, it is classified as a hairy nevus. A second common type of epidermal tumor is a verruca or wart. The plural of verruca is verrucae. Warts are often caused by a virus. Perhaps you've been told that handling frogs can give you warts. So, can you get warts from frogs? The answer is no. Handling frogs can't give you warts. Warts are caused by the HPV or human papillomavirus, which is only carried by humans. So go ahead, pick up that cute little toad. Just don't waste your time kissing them. That rumor that they will turn into a prince or princess and become your one true love is also a myth. Bummer. Sometimes objective findings must proceed beyond what is visible to the naked eye. Here are a few common tests that might be used in dermatology to assist a practitioner in making an accurate diagnosis. While it might sound like some kind of new human resources training, culture and sensitivity is actually a process that involves taking a sample of the substance to determine the pathogen and what will kill it. In dermatology, a sample of the affected skin is taken and grown as a lab culture. Different antibiotics or medications are then applied to the culture to determine the most effective treatment. Biopsies are another common dermatological diagnostic procedure. As with culture and sensitivity, results of the biopsy would be included in the objective section of the medical record as a lab test or result. A biopsy is a sampling of the skin tissue to determine the cause of an abnormality. It can help determine if the patient has a fungal, bacterial, or viral infection, or whether a sample is benign or cancerous. An excisional biopsy removes the entire lesion, whereas an incisional biopsy removes only a portion of the lesion. Incisional biopsies can include shave or punch biopsies. A shave biopsy takes off small slices off the surface of the lesion, much like a cheese grater. To view deeper layers, a punch biopsy removes a circular area of the skin along with the underlying layers of tissue, much like a hole punch. As with all good things, this lecture too must come to an end. Thanks for exploring objective terms related to the integumentary system with me. See you next time. Welcome. Thanks for joining me today. In this lecture, we will discuss some common medical terms related to the integumentary system that you might find in the assessment portion of a dermatology note. Recall that assessment terms are the diagnosis or differential diagnoses that the practitioner has decided after careful assessment of the subjective patient report and the objective findings. They describe the diagnosis of the condition. This patient must have had a good diagnosis. Look at how happy they are. No one looks like that delivering news like, you know that rash you came to see me about? Turns out you have a yet undiscovered fungus. Skin diagnoses are generally related to infections, inflammation, tumors, or changes in the skin. A decubitus ulcer is more commonly known as a bed sore and currently referred to as a pressure injury. It is the loss of tissue due to prolonged pressure, usually over a bony prominence or area where the bone lies close to the skin. Have you ever fallen asleep on a book while studying? The red mark that often results on your forehead afterward is actually a stage 1 decubitus ulcer. In healthy individuals with intact sensation and normal mobility, these usually resolve on their own when blood flow is restored after the pressure is relieved. However, in individuals with compromised sensation who may not feel the discomfort, or individuals with impaired mobility who might not be able to move to relieve the pressure, these pressure injuries can progress to permanent death of tissue. It is crucial to assist at-risk patients in changing position every 2 hours around the clock to prevent the formation of decubitus ulcers. Prevention of these pressure injuries is far more effective than treatment. In other words, no one should be parked in the same spot for over 2 hours. Atopic dermatitis is an unusual inflammation of the skin, also known as eczema. It is more common in children but can occur at any age. The result is skin that is red, itchy, and dry. Fun fact, 1 in 10 individuals, including one of my twin sons, will develop eczema during their lifetime. It is equal across all skin colors and ethnicities. As with atopic dermatitis, psoriasis causes itchy and red skin. However, psoriasis is also accompanied by scaly plaques from excessive growth of skin cells. It usually appears in early adulthood and most often on the scalp, elbows, knees, and lower back. Other common diagnoses of the integumentary system include skin cancers. Here are a few of the most common types. Basal cell carcinomas are the cancerous tumors of the basal skin cells. They are the most common cancer of the skin, but also the least dangerous. They usually appear as a flesh-colored and pearly nodule on areas commonly exposed to the sun. Malignant melanomas are a cancerous tumor of the melanin or pigment-producing cells known as melanocytes. Opposite to basal cell carcinoma, malignant melanomas are relatively uncommon, but are responsible for the most skin cancer deaths. They often present as a brown discoloration on the skin. When considering a mole versus a melanoma, try to remember the ABCD rule. Asymmetry, irregular borders, color variability, and a diameter larger than a pencil eraser are all suggestive of a melanoma and cause for concern. The third type of malignant skin tissue we will explore is squamous cell carcinoma. Squamous cell carcinoma is a cancerous tumor of the squamous skin cells. They often start as a small papule, which eventually leads to the formation of an ulcer. Squamous cell carcinomas are the second most common type of skin cancer, but are usually treated with great success. And now for a brain break. And with that, we move into our next assessment term category, fungal infections, or mycoses, my favorite. Tinea is a skin fungus that can present differently on different parts of the body. Tinea pedis, more commonly known as athlete's foot, is pictured on the left, while Tinea corporis, or ringworm, is pictured on the right. All tinea infections are highly contagious but treatable. Care should be taken to avoid contact with contaminated skin and objects to prevent spread from one individual to another. Shower shoes, people. Another fungal infection targets the nails of the hands and feet. Onychomycosis is a fungal infection of the nail. It causes discoloration, thickening, and separation from the nail bed and occurs in roughly half of all adults over the age of 70. Here is some free life advice from your friendly neighborhood midterm teacher. If you choose to go to nail salons, please make sure they are sanitizing properly. Plastic liners and personal or disposable tools for each client are a great start. Otherwise, you might leave with more than just cute toes. You're welcome. In addition to fungi, other infections and inflammations are also commonly diagnosed in the integumentary system. Isn't that exciting? Common acne, or acne vulgaris, is a type of bacterial skin infection. It occurs when hair follicles plug with oil and dead skin cells, and is the most prevalent in teenagers and young adults. Symptoms can vary widely, from simple blackheads to pustules to large red welts. Our final diagnosis is not an infection, but rather an inflammation. Seborrheic dermatitis is an inflammation of the skin caused by excessive discharge of sebum or oil known as seborrhea. Patches usually occur on the scalp or other oily areas of the body like the face, upper chest, and back. Seborrheic dermatitis can also cause persistent dandruff. As with all good things, this lecture too must come to an end. Thanks for exploring objective terms related to the integumentary system with me. See you next time. Welcome! I'm beginning to recognize you at this point. It's so good to see you again. In this lecture, we will discuss some common medical terms related to the integumentary system that you might find in the plan portion of a dermatology note. Recall that plan terms refer to the treatment or therapy that the practitioner has decided will best address the diagnosis from the assessment section. Sometimes the plan may also include further testing to rule out differential diagnoses or referrals to other practitioners to assist in clarifying an unknown diagnosis. There are three main classes of medications that treat conditions of the integumentary system: anti-infection, anti-immune, and anti-itch. We will look at these classes in more detail in the coming slides. Anti-infection include antibiotics and antiseptics. Remember that antibiotics are only effective against bacterial infections of the skin like impetigo, but are not effective against viral infections like Verrucay. Antiseptics are cleaning agents and can be helpful in treating diagnoses like acne vulgaris. Steroids are a common treatment to address a hyperactive immune response like you might find with urticaria. They are also used as anti-inflammatories to treat other skin conditions like atopic dermatitis. Roids are also illegal performance-enhancing drugs. Don't worry, your prescription from your dermatologist won't give you superhuman strength and anger issues, although he should probably see someone about that green skin tint. Another treatment for common skin issues addresses allergens and general pruritus or itching. This class of anti-itch medications is known broadly as antihistamines. As the name suggests, they block the histamine response known to cause the itching associated with skin irritations caused by anything from bug bites to psoriasis. Medications used to treat integumentary disorders can be delivered in various ways. These can include creams applied directly to the skin, oral pills, or even injections. Perhaps one of the unique options for treating issues of the integumentary system as opposed to other body systems is the frequent use of topical medications. Topical medications usually come in cream form and are applied directly to the skin. They are then absorbed directly into the affected area, thus effectively avoiding dilution in the bloodstream. Topical applications also allow for targeted treatment isolated to a single area, as opposed to a more systemic distribution as seen with oral pills. And now for story time with Kabiri. Once upon a time, a son developed a terrible case of poison ivy. Wanting to abate the terrible pruritus, he decided to take his medicine the doctor gave him by himself. When he took the pill out of the bottle, he noticed it was a little big to swallow, but he tried and he tried and he did it. When he proudly told his mother, she immediately freaked out. Upon further reflection on the label, the tablet was supposed to be dissolved in water and applied topically, not orally. Being a good mother, she immediately called poison control, who told her to place her son upon her knee and attempt to get him to regurgitate the tablet. When asked how old her son was, she laughed and replied, 23. Don't ignore topical delivery instructions. The end. Another option for medication delivery involves injections. Perhaps you've heard of a hypodermic needle. Hypodermic and subcutaneous both refer to something under the skin. A cortisone injection is a common steroid delivery method. Hypodermic or subcutaneous injections also allow for a very specific treatment localized to the affected area. A third method for delivering medications involves having the drug pass through the skin. The term percutaneous often is used with surgical procedures, while the term transdermal is used when referring to a medication delivery, as in the transdermal patch seen here. As with topical and hypodermic deliveries, percutaneous or transdermal medication targets a specific area. However, it allows for an extended release of medication unique to this method. Patches are often waterproof and can be worn for up to days at a time. And now for a brain break. Doesn't that feel better? Sometimes medications are not enough to adequately address dermatological issues, or perhaps a surgery or procedure might simply yield better results. Regardless, here are a few common dermatological procedures used to address integumentary system issues. One procedure common in dermatology is cryosurgery. Cryosurgery involves destroying tissue by freezing. This is often accomplished by the application of liquid nitrogen. Once the tissue is frozen, it dies and is easily removed. This is a particularly common treatment for the removal of warts or verrucae. Sometimes a nail infection will progress to the point that surgical procedure becomes necessary. An onychotomy simply makes an incision into the nail. This is usually to allow the fluid underneath the nail to drain and relieve pressure, such as with a blood blister. An onychectomy, on the other hand, is a full removal of the nail. Anyone else ever had this happen after a marathon? Onychectomies and other nail issues are also common in ballet dancers who dance and point using toe shoes. If a more aggressive treatment is required to treat a dermatological problem, an incision and drainage, or I&D, may be required. This surgical procedure involves cutting open infected skin and removing any subcutaneous drainage underneath. The wound is then packed with sterile gauze and wrapped to allow for healing from the inside out. Large abscesses are often treated with I&D procedures. Severe burns often require temporary or permanent skin grafting to protect the wound and to promote healing. Autografts are a permanent skin graft taken from the patient's own skin. To create extra skin for grafting, spacers can be placed under the skin in the abdomen or other locations and gradually filled to stretch the overlying skin. This creates extra skin that can then be removed later for grafting. Homograft and allograft are different terms for the same thing. Both mean a skin graft taken from another member of the patient's species. In humans, cadaver grafts fall into this category. Heterografts and xenografts are synonymous terms, but mean a skin graft taken from a species other than the patient's. In humans, pig skin is often used for grafting. Homografts, allografts, heterografts, and xenografts are all temporary skin transplants until permanent autografting can take place. The following procedures are predominantly used to address cosmetic integumentary issues, but may also be used to treat medical issues as the practitioner deems necessary. Often, a simple removal of the outer layer of the epidermis can treat integumentary issues. Dermabrasion scrapes or rubs away the skin's outer surface and can be done in the clinic or using over-the-counter devices. You might associate this procedure with treatment of common cosmetic integumentary issues like fine lines and wrinkles or skin discolorations. However, it can also be used to treat other medical conditions like acne vulgaris. Did you know that once you gain a fat cell, you never lose it? You might be able to shrink it or empty it through diet and exercise, but it remains in the body, ready to store the next drop of excess fat you consume. When doing cadaver dissection, I noticed that fat cells resemble little balls of butter. Makes you think twice about that baked potato. The only way to effectively remove fat cells is through a lipectomy or liposuction. Liposuction is a surgical procedure that uses vacuum suction to remove fatty tissue. The last cosmetic procedure I would like to explore today is rhytidoplasty, or surgical reconstruction of the wrinkled skin. This procedure is commonly applied to the face and neck. Face lifts, eye lifts, and neck or chin lifts are all forms of rhytidoplasty. As with all good things, this lecture too must come to an end. Thanks for exploring plan terms related to the integumentary system with me. See you next time. Welcome! Thanks for joining me. In this lecture, we will explore medical terminology as it relates to my personal favorite, the musculoskeletal system. Let's get started. Woohoo! The musculoskeletal system contains both your muscles and your bones. To understand how they might be grouped together, consider how a crane works. Wait, not that kind of crane. This kind of crane. The metal framework supports the load while the engine provides the power for the movement. In the human body, the skeleton is the framework and the muscles are the power that allow us to move. Orthopedics is the branch of medicine that specializes in treating the musculoskeletal system. As a physical therapist and professor of kinesiology, I also deal with the musculoskeletal system on a daily basis. What a dreamy job. In short, the most basic purposes of the musculoskeletal system are to provide shape and support and to allow movement. The first purpose of the musculoskeletal system relates primarily to the skeleton. Your bones serve many purposes, but the primary purpose is to provide support and shape to the human body. The second purpose of the musculoskeletal system relates primarily to the muscles. Like your bones, your muscles also serve many purposes, but the two primary purposes are to produce force and to create movement. Before we get much further in the discussion, let's go over some basic anatomy of the musculoskeletal system. To begin, we will look at the basic structure of a long bone. The ends of the bones are each called an epiphysis. The plural of epiphysis is epiphyses. You might have heard of a growth plate. The medical term for growth plate is the epiphyseal plate. This is where bone growth occurs. The epiphyseal plates become epiphyseal lines after puberty when growth is complete. The long middle part of the bone is called the diaphysis, and the metaphysis is a small area that connects the epiphysis to the diaphysis. The skeleton itself can be divided into two main parts, the axial and appendicular skeleton. The axial skeleton is made up of the skull, the spine, the sternum, and the ribs. If you're asked about anything other than the skull, spine, sternum, and ribs, it is safe to say it is not the axial skeleton. The spine is made up of vertebrae. Vertebral sections include the cervical, thoracic, lumbar, and sacral regions. The axial skeleton protects organs, particularly your heart, lungs, and squishy guts. That's why it's such a huge sign of trust when an animal rolls over on its back to expose its belly. There's no bony protection for their squishy parts in this position, so they have to be really sure you mean them well. The appendicular skeleton is made up of the bones that allow you to move your arms or upper extremities and legs or lower extremities. Which bones? Why, anything that's not the skull, spine, sternum, or ribs. The upper extremities are segmented into arms, elbows, forearms, wrists, and hands. The lower extremities have a similar arrangement known as thighs, knees, legs, ankles, and feet. A joint is where two bones meet. We tend to only think of joints that allow for movement. However, there are also immovable joints like those found in your skull. Joints are held together by supportive tissues. Ligaments typically join bone to bone, while tendons join muscle to bone. Cartilage can be found at the end of the bones, making up each movable joint and allows for smooth movement. Bursae are sacs of fluid found under tendons to cushion the structures that surround the joint and prevent fraying of the tendons with repeated movement. From bones, we move to the basic anatomy of muscles. Muscles are many bundles of muscle fibers. They are covered by a thin sheet of connective tissue called fascia. Say it with me, fascia. Muscles are attached to bones via tendons. Their function is to generate force and move the bones. There are several types of muscle: skeletal muscle, cardiac muscle, and smooth muscle. Skeletal or striated muscle attaches to bones, has striations, and is encased in fascia. It is what we commonly think of as a muscle and moves the bones voluntarily. Examples include the biceps and triceps brachii muscles. Cardiac muscle also has striations but differs slightly in packaging from skeletal muscle. It is only found in the heart and is under involuntary control. The third muscle type, smooth muscle, has no specific bundles. It lines hollow organs like blood vessels, airways, and the digestive system, and is also under involuntary control. And now for a brain break. Doesn't that feel better? We will continue our exploration by learning some new word roots related to the musculoskeletal system and the skeleton in particular. Will the fun times never end? Our first new root is perhaps the most common. Osteo means bone, as in osteopathy or periosteum. Our next root is cranio. It means head or skull, as in a craniometer, which measures the size of the skull. What a cute little one. Below the skull is the neck. Cervico is the word root for neck. You can see it in the term cervical region, which is the area of the spine which corresponds with the neck. Fun fact! Did you know that both humans and giraffes each have 7 cervical vertebrae? Giraffes are just a wee bit longer. Our next word root is costo, meaning rib. A costectomy is removal of a rib, and intercostal means pertaining to between the ribs. Fun fact! The ribs seen here are actually intercostal muscles. Pig intercostal muscles, to be specific. You're welcome. The low back region is the lumbar spine, where you can hear the root lumbo. Lumbodynia, or pain in the lower back, is a common complaint in orthopedics. Our next word root is brachio. Meaning arm, it can be found in the name of the muscle biceps brachii. Carpo means wrist. It can be seen in the words carpectomy, or removal of wrist bones, and metacarpal, which literally translates to beyond the carpal and are the bones of the hand. Maybe you've heard of carpal tunnel surgery. It's wrist surgery. The next word roots pertain to the lower extremity or leg. Femoro means femur or the thigh bone. The large artery found in the thigh that provides arterial blood to the thigh region is called the femoral artery. Fun fact, the turkey drumsticks seen here are the fowl equivalent of a human femur bone. Tibio means tibia. Commonly known as the shin bone, the tibia is the prominent bone in the lower leg. Tibialgia, or pain in the tibia, is often associated with shin splints. The final word root for the bones of the lower extremity, tarso, means ankle. Ankle sprains are a common cause of tarsalgia, or pain in the ankle. Continuing with new roots about the skeleton, let's now look at some roots pertaining to skeletal articulations or joints. The root chondro means cartilage. Cartilage can be found lining the articulating surfaces of movable joints to allow for smooth movement. You can also find cartilage in your ears and nose. Of note, cartilage is relatively avascular, meaning without blood vessels, which is why you can pierce it without losing vast amounts of blood. There would be far fewer piercings and even fewer piercers. Is that a thing, piercers? If they came with the risk of hemorrhage. It's also why cartilage in the joint is very slow to heal, if it heals at all. The main root for joint is arthro. You can find this root in words like arthritis, which is an inflammation of the joint, and arthroscopic surgery, which is performed by the insertion of a small camera and tools to view and correct problems of the joint. The final root pertaining to joints is burso, meaning bursa. Bursitis, or inflammation of the bursa, is a common cause of shoulder, knee, and hip pain. Of note, prepatellar bursitis is often known as nun's knee, carpet layer's knee, or coal miner's knee. It is an inflammation of the bursa just in front of the patella or kneecap. It is common in these professions due to frequent kneeling. To complete this lecture, we need to learn a few new word roots relating to muscles. Perhaps the most important roots for muscles are musculo, myo, and myoso, meaning muscle. You can find them in musculoskeletal, the system made up of muscles and bones, and myopathy, or disease of the muscle. Teno, tendo, and tendino all mean tendon. Tendinitis, or inflammation of the tendon, is another common orthopedic complaint and is usually caused by overuse of a muscle. You know the yellow, chewy part of the big hunk of meat you bite off of a drumstick? Yup, that's a tendon. Sorry. One root that you should never forget is kinesio. You can find it in the word kinesiology, which is the study of human movement, and also the best major on campus. The faculty are so caring and smart and funny and relatable. They look like movie stars. I digress. As with all good things, this lecture too must come to an end. Yes! Thanks for exploring the introduction and word parts related to the musculoskeletal system with me. See you next time. Welcome! You're still here! I'm so excited. In this lecture, we will discuss some common medical terms related to the musculoskeletal system that you might find in the subjective portion. Recall that subjective terms are those that the patient reports to the healthcare provider. They are the reason why the patient wants to see the orthopedic doctor or surgeon. Most often, patients will come in complaining of pain. Here are some other common musculoskeletal complaints that might also bring someone to the orthopedic clinic. Remember, these terms are not a particular diagnosis in themselves, but rather symptoms used to generate a forthcoming diagnosis. The first common complaints include ostalgia, ostealgia, and osteodynia. They all mean pain in the bone. Okay, so once when I was first married, I was out of town for my clinical rotation. I called my husband on our home phone. We used to have those because I'm old, and it was some old lady on the other end repeating, "Oh, my bones, over and over. It was so creepy. I never figured it out, but I hope her ostalgia improved. Another common complaint includes arthralgia or arthrodynia. Both words mean pain in a joint. This can be caused by many different factors, including arthritis. Then again, arthralgia can also come from doing things like this. If the pain originates in a tendon, the patient might complain of tenalgia or pain in the tendon. This is commonly seen in tendonitis. Finally, patients often seek out an orthopedic specialist for muscle pain or myalgia or myodynia. Again, there can be many causes of muscle pain, but muscle strain from abuse or overuse is one of the more common. In addition to general complaints, some patients may complain about unwanted or bothersome changes in the musculoskeletal system, including a loss of muscle mass. Wait, what? You can lose your muscles? Yes! In fact, in just 2 weeks of inactivity, young, healthy people can lose up to 30% of their body's muscle mass, making them feel decades older. You might feel like a 40-year-old medical terminology professor. The process of muscle wasting away is called muscular atrophy. Although no one wants to lose muscle mass, the good news is that it can be regained.
Yay!
The process of increasing your muscle mass, or making those muscles bigger, is called muscular hypertrophy. Most of the time, it is muscular atrophy changes rather than hypertrophy that causes someone to seek medical intervention. Sometimes, the changes in the musculoskeletal system that bring a patient to the orthopedic doctor or surgeon are not in the muscles, but rather in the joints. Ankylosis is a stiff or bent joint. Sometimes they will describe it as frozen. Crepitus is a crackling sound when the joint is bent. It can be a sign of arthritis. Personally, I've had crepitus in my joints since I was a teenager. I don't know, just do. But I'm still functional and pain-free, so there's that. And it makes a cool icebreaker. Hey, want to hear my crepitus? And now for a brain break. If the abnormal change in the musculoskeletal system that brings someone to the orthopedist involves muscle tone, the patient might complain about hypo or hypertonia. Hypotonia is a decrease in normal muscle tone or tension. Hypotonia causes movements to be floppy or generate less force. On the other hand, hypertonia is an increase in muscle tone and causes movements to be stiff or overly forceful. Either hypo or hypertonia can make muscles difficult to move. Sometimes the abnormal changes are more global in nature and can cause issues with coordination. Dystaxia and ataxia both mean poor coordination and are often a sign of an underlying neurological condition. Fun fact, ataxia can also be a result of consuming too much alcohol. That's the whole premise behind field sobriety tests. Make good choices, people. Free life advice. You're welcome. Bradykinesia is a general term for slow movement. Patients with bradykinesia are still capable of controlled voluntary movements like buttoning a shirt, but just at a greatly reduced speed. Bradykinesia, normal in turtles, not so much in humans. Besides pain and changes in musculoskeletal function, here are some other complaints one might see in orthopedics. Genu valgum and varum both refer to abnormal knee alignment. Genu valgum is when the knees are too close together under the hips and is often called knock-kneed. Genu varum is the opposite. The knees are aligned too far apart under the hips. This condition is often called bow-legged. One final musculoskeletal complaint is muscle weakness or myasthenia. The condition myasthenia gravis is characterized by muscle weakness, particularly in the muscles of the eyes and speech. Finally, I would like to conclude this lecture with a few subjective musculoskeletal terms that just might come in handy should you find yourself trying to avoid a particularly sticky situation. These terms are being provided for educational purposes only. Any use for personal gain, either real or imagined, is not endorsed by this professor, this department, this university, or any of their affiliates. Use at your own risk. Our ominous musculoskeletal term of this module is graphospasm, as in, I would love to help you type that last midterm paper, but it might agitate my recurrent graphospasm. Surely any good friend wouldn't want that to occur. Never mind that it usually refers to the writer's cramp you get when taking notes in medical terminology. As with all good things, this lecture too must come to an end. Thanks for exploring subjective terms related to the musculoskeletal system with me. See you next time. Hello, welcome back. In this lecture, we will discuss some common medical terms related to the musculoskeletal system that you might find in the objective portion of a medical record. Recall that objective terms are those that the practitioner will observe or discover through labs and tests. They are used to describe what the practitioner finds in their examination. Often, the healthcare provider will assess the conditions of bones, joints, and muscles via radiologic tests such as X-rays, CAT scans, and MRIs. Practitioners often start by simply observing a patient. Is there bone sticking out through their skin? They might have a fracture. You know, subtle clues. But seriously, orthopedic specialists constantly observe human movement. How do they move when they come into the clinic? Is there a visible limp? Are they protecting a joint or body part? Is motion restricted, or are they moving normally and symmetrically on both sides? For less obvious fractures and other bone issues, radiologic tests can be used to help visualize internal structure. X-rays can reveal fractures, osteolysis, or bone destruction, and even extra bone growth like bone spurs. Of course, they can also reveal what happened to that pair of suture scissors that was unaccounted for after surgery. Or where your keys went. Computed axial tomography, or CAT scan, is an imaging procedure using a computer to produce cross-sectional slices along an axis. It is basically a series of X-rays combined to form a single manipulatable image. You know what they say, after the CAT scan comes the lab tests. MRI stands for magnetic resonance imaging. Unlike CAT scans, MRIs are great for showing soft tissue like muscles, tendons, and ligaments. They can also show fractures in bone. However, MRI machines use a strong magnetic field to create the image, so be sure to remove all those piercings and avoid wearing metal zippers or buttons. No one wants any unexpected removals. Arthroscopy is a common procedure to explore pain or dysfunction in a joint. Sometimes patients will have an exploratory arthroscopy where the practitioner wants to see what is going on. This is perhaps most commonly done in knees, where cartilage and/or menisci can become easily frayed or trapped, causing pain. If this is the case, the surgeon may choose to go ahead and clean up the frayed edges or remove the damaged tissue during the exploratory procedure. To test the electrical activity of a muscle, a clinician might use electromyography, or EMG. This can be done by inserting needles, ouch, or the use of surface electrodes, much better. EMG is also used to test the ability of a nerve to conduct electrical signals down its entire length. These tests might be commonly ordered in someone with a pinched nerve or weakness, numbness, or tingling in a particular area. It can also be used to test the amount of force a muscle can produce or the speed with which it contracts. Nifty! And now for a brain break. The following are abnormal observations one might make pertaining to bones. You know, like the hip bone connected to the face bone. In case you didn't know, that's not normal. The first three observations about bones refer to abnormal spinal curvatures. Kyphosis is an abnormal forward curvature of the upper spine. It is commonly seen in elderly people as a result of lots of teeny tiny spinal fractures on the front of the thoracic vertebrae that make them cave in on themselves. Like kyphosis, lordosis is also an abnormal curvature of the spine. However, it involves an exaggerated curve in the lumbar spine and makes the patient seem like they are leaning back. It is commonly seen in women late in pregnancy or people with large amounts of abdominal fat due to the forward shift in their center of gravity. Attention! Free advice alert! As a mom of twins, I can attest to the painful effects of pregnancy-induced lordosis. I was a whale! Should you ever find yourself the one responsible for causing said pregnancy-induced lordosis, be ever so patient and offer unlimited free back rubs. It will go a long way to keeping you alive long enough to actually see the baby. Just ask my husband. Our third and final abnormal curvature of the spine is perhaps the most well-known, scoliosis. Scoliosis is an abnormal lateral curve of the spine and is most commonly located in the thoracic and lumbar regions. It commonly occurs during periods of rapid growth, which is why we are screened during adolescence. I have that too! Lucky me. From abnormal curvatures, we move on to fractures. A bone fracture is a break observed in the bone. A horizontal line across the bone shows a transverse fracture. A straight slanted line shows an oblique fracture, while a jagged slanted line shows a spiral fracture. An angulated fracture shows a slanted line with the bone bending away. Displaced is represented by the bone being severed and offset, while a severed bone overlapping at the edges of the break demonstrates an angulated or displaced fracture. Of note, spiral fractures are usually the result of torsion or twisting injuries commonly seen when athletes wearing cleats which anchor their foot to the ground are hit in contact sports. Moving on, let's look at some objective terms related to joints. Often, injury to a joint will result in effusion or a buildup of fluid. It is a sign of swelling or edema. This extra fluid is part of the injury response but can cause increased pressure and pain in the joint. It is commonly seen in injuries like ankle sprains. When we consider general observations about muscles, one thing that might become obvious is muscle atrophy or underdevelopment, decreased or lost muscle mass. This is commonly seen when a joint has been immobilized, as in casting for a broken bone. In healthy people, this atrophy is easily reversed once the joint heals and usual use resumes. The opposite of atrophy is hypertrophy or overdevelopment. It is what makes your muscles larger as a result of spending hours, days, weeks, and months in the gym or performing manual labor. As with all good things, this lecture too must come to an end. Thanks for exploring objective terms related to the musculoskeletal system with me. See you next time. Welcome! Thanks for joining me today. In this lecture, we will discuss some common medical terms related to the musculoskeletal system that you might find in the assessment portion of a clinic note. Terms associated with assessment are used when the healthcare provider has gathered the patient's subjective information and his or her objective information. With the musculoskeletal system, the assessment section will most likely contain diagnoses related to bones, joints, or muscles. Bone diagnoses usually involve inflammatory conditions, tumors, fractures, or congenital diseases. Let's take a look at some of the ones that are more commonly seen. Osteosarcoma is a cancerous tumor arising out of bone cells. It most often occurs in the long bones that make up the arms and legs, though it can occur in any bone. While osteosarcoma tends to occur in children and young adults, it is relatively rare. Osteogenesis imperfecta, or brittle bone disease, is a genetic disease in which the bones do not develop correctly. The affected genes change how the body makes collagen, a protein that helps strengthen bones. The condition can be mild, with only a few fractures during a person's lifetime, or more severe, involving hundreds of fractures that can occur without any apparent cause. Sometimes the simple act of helping a toddler put their arm in a sleeve can result in a fracture. Another common bone disorder is osteopenia, or a reduction in bone volume. If left untreated, osteopenia can continue to progress into full-blown bone density loss known as osteoporosis. This disease is common in postmenopausal Asian or Caucasian females with petite bone structure. Smoking and poor calcium intake, especially during adolescence and young adulthood when the bones are all growing quickly, can also increase your risk. Notably, I also have osteopenia. Got it for my 39th birthday. Thanks, Mom, and aunts, grandma, great-grandma. Spinal stenosis is an abnormal narrowing of the spinal column. This can put pressure on the spinal cord and the nerves within the spine. It commonly occurs in the neck and lower back. Symptoms can include pain, numbness, and muscle weakness. The condition is often caused by age-related wear and tear. So be kind to your spine. And now for a brain break. All right, now that we've settled that, let's look at some diagnoses related specifically to the joints. And yes, some of them are also related to aging. Enjoy your youth. I'm sure you've heard of arthritis before, right? Arthritis is a general term meaning inflammation of the joint. However, there are also more specific types of arthritis. Osteoarthritis is one type of arthritis and literally means inflammation of the bone and joint. This is the most common type of arthritis. It's caused by a wearing down of the protective tissue at the ends of the bones, known as cartilage. It occurs gradually and can worsen over time. I also have osteoarthritis. Once again, I got it for my 39th birthday, right about the same time I got diagnosed with osteopenia. 39 was rough. This is actually my thumb. I woke up one morning after working in my she shed. Yes, I have a she shed where I build furniture and stuff. And my thumb was sore, red, and angry. I went to the doctor for x-rays and bam! Bilateral osteoarthritis of the metacarpophalangeal joints of the thumb. Now I get to wear cool thumb braces when I work. Yeah. But it was totally worth it because I get to build cool things like this outdoor kitchen, and farm tables and swings and marshmallow roasting benches and dog feeding stands and candle holders and standing desks and wall decor. I digress. Squirrel! Where? Oh yeah, we were talking about arthritis. Rheumatoid arthritis is a second type of arthritis. Unlike osteoarthritis, rheumatoid arthritis is caused by an autoimmune disease which causes the body to attack its own joints. This disorder can also happen in younger people and is known as juvenile rheumatoid arthritis. It usually results in a characteristic deviation pattern of the fingers shown here. A final common diagnosis is a subluxation. A subluxation is a partial dislocation of a joint as shown here in the patient's right shoulder. You can also have a full dislocation of a joint. Once again, sports injuries are common reasons for subluxations. Finally, let's look at some common diagnoses related to muscles and other tissues of the musculoskeletal system. The general term muscular dystrophy refers to a group of genetic diseases that cause progressive weakness and loss of muscle mass. In muscular dystrophies, abnormal genes or mutations lead to muscle degeneration. Most forms begin in childhood. Damaged muscles become progressively weaker. Most people who have the condition eventually need a wheelchair. Other symptoms include trouble breathing or swallowing. Tendinitis is a condition in which the tissue connecting muscle to bone becomes inflamed. This usually occurs from repetitive stress or overuse. The cool thing about tendinitis is that they get awesome names like tennis elbow, golfer's elbow, jumper's knee, and swimmer's shoulder. Anyone else noticing the link between sports and orthopedics? The uncool thing about tendinitis is that the treatment usually involves rest, aka a break from sport. Most patients and coaches are not happy to hear that. Finally, necrotizing fasciitis is an inflammation of fascia causing the death of tissue. Fascia is a connective tissue found throughout the body and particularly around skeletal muscle. More commonly known as flesh-eating bacteria, it occurs when bacteria enter through a break in the skin and then literally eat your flesh. Of note, I had many patients with necrotizing fasciitis, and most non-drug needle-related cases, don't do drugs people, came from swimming in the bay with a cut on their hand or feet. I know it's tempting, but cover those cuts with waterproof bandages before you swim in non-chlorinated water. I also highly recommend wearing water shoes or old tennis shoes, as stepping on an oyster shell can also cut your feet. Otherwise, the bacteria just might eat your flesh. As with all good things, this lecture too must come to an end. Thanks for exploring assessment terms related to the musculoskeletal system with me. See you next time. Hello, nice to see you. In this lecture, we will discuss some common medical terms related to the musculoskeletal system that you might find in the plan portion of a clinic note. The plan is used to treat the condition of the musculoskeletal system. It can address the complaints of the patient. There are 4 main classes of medications that treat conditions of the musculoskeletal system: analgesics, anti-inflammatories, antipyretics, and antiarthritics. Antipyretics lower fever and will not be examined further in this section. However, we will look at the other classes in more detail on the coming slides. A common musculoskeletal complaint is pain. To help alleviate these symptoms, a doctor might prescribe or recommend the use of over-the-counter analgesics or pain medications. Over-the-counter pain relievers include drugs like acetaminophen. Anti-inflammatory medications address the inflammation and swelling that causes the pain rather than just the pain itself. This class of medication is commonly recommended for use with muscle strains, joint sprains, or other inflammatory conditions like arthritis. Over-the-counter examples include ibuprofen or naproxen sodium. The third class of common medications used to treat musculoskeletal complaints is antiarthritics. Antiarthritics are designed to reduce inflammation in the joints. The most commonly used over-the-counter antiarthritic drug is ibuprofen. And now for a brain break. Medications used to treat musculoskeletal issues are only one treatment option. Let's look at some other options for skeletal issues. Sometimes a practitioner might decide that bone needs to be removed. This procedure is called an osteectomy or ostectomy. This procedure is commonly used to treat bunions, shown here, and bone spurs. Fun fact! The Cinderella procedure is a cosmetic foot surgery that can include an ostectomy. It results in a narrower foot designed to fit comfortably in high heels. What we won't do for fashion. The next few slides pertain to procedures designed to correct bone fractures. A closed reduction procedure is designed to realign broken bones without surgery. This is what they did in the old days when they gave the guy a shot of whiskey and a stick to bite on while they yanked on his leg trying to make it straight again. Then they'd tie it to a board and voila! Good as new, maybe. An open reduction, as opposed to a closed reduction, involves a surgical procedure to realign broken and displaced bones. Often, the broken bone is held in place with plates and/or screws. An ORIF is both an open reduction and an internal fixation procedure where a broken bone is realigned and stabilized with plates and/or screws during a surgical procedure. This fracture has been repaired with an ORIF and multiple plates and screws. Sometimes, a bone can be held in place from the outside without requiring the use of plates or screws. Casts and splints are common types of external fixation. Other types of devices used to treat orthopedic conditions include orthotics, which straighten or help strengthen or stabilize the body part, and prostheses, which replace a missing body part. The orthotic pictured here is used to reshape a baby's head as they grow. Perhaps you've seen one. They can be used to help correct flattening of the back of the head from not having enough tummy time, or congenital malformations that can occur with overcrowding in utero, especially common in multiples. And now for story time with Kabiri. Once upon a time, a woman became pregnant with twin sons. During the last few months of the pregnancy, one twin sat on the other and refused to move. He just so happened to trap his brother with his head stuck on the left half of her pelvis. One day, the twins were born. The twin who had been trapped was born first. Happy birthday, twin A! But the poor guy had a head shaped like his mom's pelvis, more triangular than round. So his most excellent and educated mother took him to see the orthotist. They made him the cutest little cranial orthosis, and she decorated it to look like a football helmet. It stunk a lot because she couldn't wash it, and he wore it 11 months. The end. Sometimes the musculoskeletal procedure involves a joint or joint structures rather than a single bone. Let's look at some common options designed to treat joints. Arthrodesis is surgical immobilization of a joint by fusion of the adjacent bones. It prevents the joint from moving anymore, usually to resolve pain from chronic instability that can't be resolved with medication, splints, or bracing. Arthroplasty is surgical reconstruction of a joint. The most common ones are total hip arthroplasty and total knee arthroplasty. Total shoulder arthroplasties are also performed regularly. You will commonly hear these procedures referred to as joint replacements and are usually the result of chronic pain or arthritis that inhibits functional mobility. I had a patient once who was a professional ballet instructor. She had undergone bilateral hip arthroplasties and was preparing for bilateral knee arthroplasties. She joked that it was her plan for eternal youth, that she got younger with every new part. There are many abbreviations common to the musculoskeletal system. Here are my favorites. If you ask a patient, they might tell you PT stands for pain and torture. However, it really stands for physical therapy. Physical therapists specialize in disorders of the human movement system, and while many of their techniques can cause temporary soreness or discomfort, the long-term gains are well worth the effort, even if I am partial. The only job better than physical therapist is medical terminology professor. My second favorite musculoskeletal abbreviation is RICE. Why? Because it's like the best university ever, and it also stands for First Aid to Address Sprains and Strains. Rest, ice, compression, and elevation. These 4 steps, along with over-the-counter anti-inflammatories as advised by your doctor or pharmacist for 24 to 48 hours, will also help with most common muscle and joint aches and pains. As with all good things, this lecture too must come to an end.
Yes!
Thanks for exploring plan terms related to the musculoskeletal system with me. See you next time. Welcome back! In this lecture, we will continue our exploration of medical terminology with a look at the urinary system. Here we go. Let's begin with a look at the basic purpose and anatomy of the urinary system. The first purpose of the urinary system is to filter the blood. The kidneys do this by removing waste from the blood and retaining things the body needs. This helps balance the blood's pH, mineral, water, and glucose content. So what happens to the waste? Glad you asked. The second and perhaps most obvious purpose of the urinary system is to create urine. This is what happens to the waste. Anything that is not needed gets excreted in the form of urine, which is stored in the urinary bladder until it can be emptied. Now that we know why we have a urinary system, let's take a look at the parts of the urinary system. We mentioned that the kidneys filter the blood and create urine. As such, they are the first part of the urinary system. You have both a right and left kidney, although some people are born with only one. And it's fine! Yep, you can live with only one kidney. Perhaps you might have the chance to donate one someday. Hero! Once the urine is formed in the kidneys, the urine leaves the kidneys through the right or left ureter, which takes the urine from the kidneys to the urinary bladder. Both the right and left ureters drain into a single urinary bladder. Most people call this the bladder, but since you also have other bladders, like the gallbladder, it's best to use the full name. The urinary bladder is a smooth muscle known as the detrusor muscle and holds urine until you are ready to void or urinate. Urination requires two sphincters to relax and allow urine to leave the urinary bladder through the urethra and into the external environment. Ta-da! The urinary system. Now for a 10-second brain break. To finish, we should probably learn some new word roots related to the urinary system. Yeah, that's a good idea. Let's do that. The roots uro and urino both mean urine. You can see them in words like urologist and urinalysis. I'm not sure why the sample seems to be glowing. Radiation or special lighting? The roots nephro and reno both mean kidney. You can see these roots in words like nephrologist and renal. The magical fruit shown here is a pile of kidney beans, named for their resemblance in both shape and color to the actual organ. Ureter O is the root for ureter. After the urine is made in the kidneys, it goes to the bladder via the straw-like ureter. Fun fact, ureters can defy gravity. Even upside down or in outer space, urine drains down from the kidneys to the bladder. How amazing are you? The roots cysto and vesico both mean urinary bladder. Remember, we usually refer to it as the urinary bladder to distinguish it from other bladders like the gallbladder. The bladder holds urine until it is ready to be excreted, hopefully, but more on that later. The urethra is the tube from the urinary bladder to the external environment. It transports the urine to its final destination. Did you know one of my first jobs was cleaning these? Yep, and I did a good job too. As with all good things, this lecture too must come to an end. Thanks for exploring introductory terms and word roots related to the urinary system with me. See you next time. Greetings once again. Since you already have a good grasp on the prefixes and suffixes common to most medical terms, we are going to combine the subjective and objective terms for the urinary system. Buckle up. The following slides contain common complaints and observations regarding disorders of the urinary system. One alarming finding that might cause a patient to seek medical care is hematuria, or blood in the urine. Normal urine should be pale yellow or about the color of lemonade. Urine that is orange, brownish, or red could indicate hematuria. Of note, dehydration can also cause a darkening of the urine. So unless it's bright red, urine color alone may not indicate hematuria. Simple urine tests can indicate the presence of blood cells in the urine. Any blood in the urine is abnormal. In summary, lemonade, good. Cream soda, hot or iced tea, strawberry soda, bad. Sometimes a patient may see a urologist for painful urination. The terms dysuria and uridynia both mean painful urination. As urination should never be painful, this is an abnormal finding and should be reported to your doctor. Incontinence is an inability to control urination. There are different types of incontinence like stress incontinence and urge incontinence. This condition is common after childbirth, prostate surgery, and with aging. However, any incontinence is abnormal and not something you just have to live with. Pelvic floor physical therapy can treat and fix incontinence without surgery in as little as a few weeks or months. Please don't suffer through incontinence on your own. Go see a pelvic floor physical therapist. Nocturnal enuresis is involuntary urination at nighttime, more commonly known as bedwetting. It is common in children even up into their preteen years. My dog had nocturnal enuresis a while back in my bed. Now she has her own bed. Nephralgia is the medical term for pain in the kidney. It usually presents as intermittent low back pain and might be unilateral or bilateral. Kidney stones and infections are common causes of nephralgia. Now for a 10-second brain break. And now for story time with Kabiri. Once upon a time, a grown man started having back pain while on vacation. Being a strong and stubborn man, he ignored it. It would come and go without reason. Still, he ignored it. After all, he was on vacation. Then one day he started vomiting and had blood in his urine. This caused his wife to say, maybe you shouldn't be ignoring this any longer. A quick trip to the out-of-state emergency room later, he was diagnosed with not one, but 2 renal calculi or kidney stones. As the pain of passing a kidney stone through the narrow male urethra is supposed to be the closest thing a man can experience to childbirth, the 2 stones were dubbed the twins. Every day, people would call and check. Had they been born yet? Should gifts be sent? Then one day, they passed. He cried. The end. The following slides contain common observations regarding disorders of the urinary system. To help determine if the urine is normal or abnormal, a urinalysis might be ordered and findings reviewed by a healthcare practitioner. Urinalysis generally refers to a group of tests on the same urine sample. First, a visual inspection will be performed examining both the color and clarity of the urine. Cloudy, dark, or abnormally colored urine are abnormal findings. A chemical test can also be run to look for abnormal substances in the urine like blood cells, protein, or sugar. Additional examination under a microscope can provide additional information on the types and number of abnormal cells or substances. While not part of a traditional urinalysis, a urine culture is another test that a practitioner might order to examine the urine. A urine culture is performed to grow or culture a particular pathogen or bacteria present in urine. These tests are particularly useful in treating urinary tract infections, as it will also help determine the proper medication needed to kill the bacteria. These tests are particularly not useful, though, as they take days to grow in the lab. Days, people! However, the practitioner may choose to start the patient on an antibiotic, which can later be confirmed or changed pending urine culture results. Sometimes the healthcare practitioner might want to see how your urinary system is functioning to help diagnose the cause. Avoiding cystourethrogram is special imaging that is performed during urination to watch the function of the bladder and urethra. Nifty. By the way, do you know what we call a pool full of kids? A urine sample. As with all good things, this lecture too must come to an end. Thanks for exploring subjective and objective terms related to the urinary system with me. See you next time. Welcome back. Let's finish up with some common assessment and plan terms for the urinary system. Up first, urinary system assessment terms. Woo! A general term, nephropathy means a disease of the kidney. It is a common reason for patients to seek out the care of a nephrologist or a specialist in the care of the kidneys. It is also a common reason for patients to have low back pain, muscle strain, or nephropathy. A nephrologist can help you figure it out. One of the most common diagnoses related to kidneys is nephrolithiasis or kidney stones. Also known as renal calculi, these little guys can wreak havoc on the urinary system. Most often, these stones are calcium-based. An analysis of the stone, once passed, can help determine its composition and help prevent recurring stones. A UTI, or urinary tract infection, is just that, an infection of the urinary tract. They are far more common in females than males simply due to anatomical variations. Symptoms include painful and frequent urination, a strong urge to urinate, and blood in the urine. Pelvic pain can also occur, and if left untreated, a UTI can spread backward from the bladder to the kidneys, causing a kidney infection as well. The most common cause of a UTI is the introduction of bacteria like E. coli into the urinary tract. Please, please, please always wipe from front to back and never back to front, as this is an easy way to introduce E. coli into the urinary tract. Remember that if you ever have to change your sweet newborn's dirty diaper. UTIs are no fun for anyone, but especially for infants who cannot tell you early enough to avoid additional complications. End soapbox. Renal failure or kidney failure is a general term for any reason why the kidneys don't work as efficiently as they should. It might be from a blood flow issue or end-stage kidney disease. Fortunately, kidneys can be replaced with one from a live donor. Both the donor and patient can function just fine with one. I'm a future donor. I am currently incubating one for a family member whenever they need it. Now for a 10-second brain break. Let's finish up with some common treatments for the urinary system. Diuretics are medications that promote or facilitate urine formation. Also known as water pills, diuretics are commonly prescribed for fluid overload conditions like hypertension and heart failure. People taking diuretics usually like to take them when they will be home for a little while to allow them to take full effect in the comfort of their own home. Fun fact! Asparagus, cabbage, and even watermelon are reported to have a mild natural diuretic effect. Yum! Antidiuretics are medications that inhibit urine formation. They are the opposite of diuretics. They reduce the amount of urine produced and are commonly prescribed for diabetes insipidus. Catheterization, or more specifically urinary catheterization, is the placement of a hollow tube into the bladder to drain urine using the urethra for access. This is a much more uncomfortable procedure for males than females due to anatomical variations in the urethra. Perhaps you've seen a bag like this on a patient's bedside. It's a Foley catheter bag and should always be moved with the patient and kept below the level of the bladder to prevent backflow. Don't worry, they'll remind you real quick if you forget it. It only happened once, I promise. If the kidneys are not functioning effectively, it may become necessary to have external filtration of the blood to remove waste like hemodialysis. Also called kidney dialysis, it is a time-consuming process and often leaves patients feeling wiped out. Now, dialysis companies are working to improve the experience by offering in-home dialysis and even spa treatments during hemodialysis. Now that's forward thinking. As with all good things, this lecture too must come to an end. Thanks for exploring assessment and plan terms related to the urinary system with me. See you next time. Wow! Congratulations on making it through the first course of the specialization. In these 4 modules, we introduced medical terminology and discussed the importance of learning the language. We learned how to break down and build medical terms and discussed common organization patterns of medical records and explored frequently used abbreviations. We finished Course 1 with a look at medical terms related to 3 body systems: integumentary, urinary, and musculoskeletal. Hopefully you have become familiar with the pattern of the modules and are looking forward to continuing your studies with Course 2, Hormones, Heart, and Lungs. Here we will discuss medical terms related to relatively unimportant stuff like breathing and heartbeats. Just kidding, it's not unimportant information, it's vital information. Get it? Vital information? Because respiratory and heart rates are vital signs. So much to look forward to. See you in the next course.